Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Good morning, everyone, and welcome to another edition of Cancer Awareness with Dr. Denise Ejo, CEO of Cornwall Cancer Foundation. This is in partnership with AIT. Happy New Year to you all, and we want to thank you for a new year, for a new beginning. We thank God for everything that has happened, and we are all excited to be starting the year in a very good space. In my view, we've all made it. And today in the house, we're waiting for Dr. Aminu to, there he is. Dr. Aminu, unmute your mic. Thank you. Thank you.
Good morning.
Good morning.
Good morning, Dr. Dennis.
How are you? Happy New Year.
Same to you. Happy New Year.
Thank you. Thank you for joining us this morning to begin 2023. And we're starting the year with cervical cancer. That's an essential conversation we need to have. So let me first quickly introduce Dr. Aminu. He's very, very modest. So he's made my life very hard, and I'm going to just have to take what he's given me. Dr. Aminu is a medical doctor, a public health specialist, and a medical coordinator for Medicaid Cancer Foundation. He's also an advisor on public health to the Adamawa State Governor. He has a master's and continues to develop himself in his various skills. We want to thank you. I told you really wanted to make it very difficult for me this morning, but it doesn't matter. Welcome to another one of our editions of Kakaki Cancer Awareness. We're looking forward to the conversation with you. But so that we set the scene, because this is Cervical Cancer Awareness Month. Now, I say cervical, I'm being told it's cervical. Whichever way, please just accept it the way I say it, because that's what I always knew it as. Yeah? So you just understand me. So let's first look at it. First, let us all look at the facts and let us thank God that we are here and we're beginning this year, and we're going to be starting this conversation with some facts about cervical cancer that we all need to do. No, HPV is not included in the national vaccination program. Is that correct? Yeah, that's for Nigeria I'm talking about. Anything I talk about is about Nigeria. Okay. Doc, you're going to have to correct, you're going to have to help me so that nobody says I'm giving wrong information. You know, this is television. I say the wrong things. Data. The screening for cervical cancer data for 2019, it says in the last 5 years, 11% screening in the last 5 years have been screened, and ever screened in their lives are 14% of our Nigerian population, right? Which is let us keep going. So understanding the global call for action becomes very important. What are the global calls for action? Who has targets towards cervical cancer elimination by 2030? And it's got, you guys call it the 90, 70, 90. But so that our viewers understand what we're talking about, the 90 is 90% of women screened for HPV. The 70 is 70% of women with HPV positive tests receive HPV vaccine. And then the other 90% is 90% of identified cervical cancer positive detected. So I'm trying to set the scene so that at least the viewers understand that there is an agenda. It's not just a Nigerian agenda, it's a global agenda. But for our perspective, we need to look at it from the Nigerian space. So starting with you now, Doc, will you please tell us, is there a path to Nigeria achieving this 90, 70, 90 target?
Thank you, Dr. Dennis. I remain Dr. Aminu. And you? And I'm not making your life hard this morning. Yes, so Nigeria is on course to achieving the 90-70-90 WHO strategy, with the First Ladies Against Cancer taking the lead to ensure that the elimination of cervical cancer by 2030 is being achieved. By so doing, the First Ladies in Nigeria have formed a coalition to ensure that this is achieved. We have done it before with HIV. We have a platform where HIV, tuberculosis, and COVID are being laid. And cervical cancer or cancer in general can ride on these platforms and ensure that these eliminations are the strategy and the elimination plan for 2030 is being achieved. How do we achieve this is to ensure that we have to activate the National Cancer Control Plan, which is already some states have adopted that. We have in Kebbi State, we have a strong Kebbi state control plan. Also ensure that Nigeria has a financial backup for this elimination strategy. The Nigerian Health Insurance Authority have launched a component of cancer treatment in the health insurance scheme. So this is the right move in the right direction to ensure that cancer patients do not spend so much out of pocket and making them so vulnerable, and also ensuring that they have some sense of reduced stigmatization in the society. Also, we have what you call the registries. Nigeria now have to improve more in ensuring that there are so much cervical or cancer registries across the country, both hospital-based and population-based cervical registries. By so doing, we know the data and we improve in the researches needed to ensure that these strategies are also eliminated. We also want to improve in surveillance structures. Nigerians have a low surveillance structure on cervical cancer, so we want to ensure that this surveillance is being activated and ensure that there's so much eyes on the cancer space, especially in the northern part of the country. We also want to improve in the vaccination of cervical cancer, because the whole strategy, the 90-70-90, the 90 means 90% of young ladies, adolescent ladies, are vaccinated, especially at school level. 70 are being screened. So we want to ensure that there are good screening tools to ensure that women are screened, and also the other 90 is to ensure that there are good treatment. They are being treated. Those that have been screened are treated, not just to screen and leave, to ensure that people that are screened are properly treated. So the 90-70-90 strategy is on course. Nigeria is on course. And then if you bear witness with me that the Nigerian NSIA, Sovereign Investment Authority, are investing so much in establishment of cancer treatment centers, about 6 of them, about 21 diagnostic centers by the NSIA will be launched very soon, but they have a modest one in Lagos, the Luth NSIA scheme, that is treating cancer patients day in, day out. So Nigeria is on course, and we believe with the right pool, right leadership, right financial support, public health research being improved, private sector involvement, public partnership, civil society, local leaders supporting the cause, Nigeria will be right, and Nigeria will be ready for the elimination of cervical cancer in Nigeria. Thank you.
Okay, thank you. As you will appreciate, I'm going to make it easy. That's what we agreed here. So let me make it easy. Very quickly, can you just quickly tell the public what this HPV is? Because I somehow missed that. We need to educate. What is this HPV, by the way?
So HPV is a human papilloma virus. It's a virus that constitutes 70% to cervical cancer. And it is one of the cervical cancer is one of the most preventable diseases in the whole universe, with 70% with a vaccine that is curative, and a disease that, when detected early, can be treated.
Thank you. So now I've got what I wanted. So now let's look at Nigeria again. What are the challenges of providing HPV vaccine to adolescent girls in Nigeria so as to protect them from this disease, especially in the future? Because one of the things I'm very mindful of is I can remember when it first came out many, many years ago, I think about almost 30 years now, and the challenges that was had, especially globally with ethnic minorities. When I say ethnic, people from the Afro-Caribbean race globally. And we were the ones resisting this vaccine. Now, how is that happening? Now the world has moved on. Everybody's taking it. At least most people are. I still know a lot of Nigerians who would not take it. I still know they wouldn't allow their children to take it, and they are educated. How are you? What are the challenges you are going to be you're faced or you're facing to get this vaccine in? Because we know once it gets in, right, it works. But you have to get it in. You've got to get it into their arms.
So generally, you could believe with me that vaccine hesitancy is something that it's a global phenomenon. Yes. So not just the HPV vaccine, other vaccines, people find it very, very difficult in accepting the effectivity of vaccines. A case study in Nigeria, I would tell you that vaccine uptake with the COVID pandemic has really improved the thoughts of people on vaccine hesitancy. So with adolescent women, we're still facing the problem of vaccine hesitancy because of some factors, which includes some form of cultural beliefs. People still don't believe in the effectivity of vaccine. People still believe that vaccine introduction poses some threat to their health systems. And people still believe, especially the young ladies, are not empowered enough to make their own informed decision to take the vaccines. Some have to, get the consents of their husbands, especially the young married ones, which have to, especially in the northern part of Nigeria, which was still increasing the awareness and increasing vaccine education. So it's still a barrier in the country, and we're improving on the vaccine education in mosques, in church, in gatherings, even in political gatherings now. People talk about these vaccines and the effectivity of it, so that we have a country where by 2030, we try and achieve this 90% of the strategy to ensure that adolescent girls within the ages of 15 are vaccinated. So it's still a problem, but the strategies are being put to ensure that there is an increased uptake on these vaccines.
I'm going to sidetrack a bit because for us to achieve this strategy, there is a funding implication. Can you give us an idea of how is that going to be managed? Because I do know that in the private sector, people go and pay to get this vaccine done. And it's not exactly cheap. Or maybe I'm wrong. Can you clarify that? Because if we're going to be able to say we want to, and I'm an advocate, as you recognize, living with this disease, I will do anything to make noise to get people to do this. How do we get, what are the tools we need to be able to make people understand?
Okay, so tools in terms of vaccine education, is that what you're talking about?
Yeah, but also the fact that we people have challenge because the funding is not available. Or am I wrong? Can you go to a hospital and get the vaccine for free?
Yes, so what we're trying to do here is to ensure that these vaccines are given for free. especially at the school level. Adolescent girls get these vaccines for free. And young pregnant women, during the antenatal services, we ensure that we put it as part of their, routine antenatal checkups. So we ensure that they get these vaccines for free. Vaccines, HPV vaccines are not quite cheap. We're working with the National Primary Health Care international partners to ensure that we get funding as well as supply of vaccines for at least a targeted group of young ladies so that we can achieve this national WHO strategy. So there is no intention to make young ladies or young adolescent students or young pregnant women to purchase these vaccines, because we know the purchasing power of such vaccines and how it could hinder the uptake, and also trying to avoid vaccine hesitancy. Because already we have a problem of vaccine hesitancy, and now if we try to introduce a further financial burden on the vaccines, it will completely kill off the idea. So we ensure that we'll try as much as possible to ensure that young ladies, young adolescent ladies, young pregnant women will get these vaccines for free as much as possible.
Okay, so I can establish now that so that people don't get it wrong. We don't have it for free as of now, but there is work in progress to try and get it for free.
Yes.
Are we expecting to be able to start this before the end of this year, or are we got a long way to go?
So we're running around the clock to see how there is a supply of a pool chain of HPV vaccine in the national budget. And we're trying to see how these things could reach to hospitals where we have pregnant women, as well as schools, clinics, where people can take it as part of their routine school vaccination programs, as well as work with NGOs to ensure that they take it as a project to vaccinate schools. So for now in the country, there is no free HPV vaccine, but we're trying to ensure that these vaccines are getting modest this year, and people get it so that we can collectively achieve the 2030 aims.
Okay, so if I was going to say from what you've just said to me now, if I was put in front of any of the people going for presidency or whatever, and I said to them, excuse me, can you guarantee that you will make sure at least the young children have access to this vaccine? You would say to me, that's a good agenda. Is that correct?
Yes, I will.
Okay. I'm coming to the end of this, but I want to check something with you. What are the barriers now, therefore, of achieving this? Because you've gone through all the strategy, the prevention, and the issues to do with the hesitancies and all that. But you must have barriers. And for me to address the barriers, what I'm looking for is, give me two things. Okay, let me make it three so that it kills it one time. A personal thing people have to do, a thing that the nation has to do, and the thing that the government have to do to help us to drive this. Because since it is a curable or managed disease that there is hope for us women, it is important that we're all stakeholders in this. So we're all partners. So let the partnership show the three of us in this partnership. Give me the three. Can you please help me with three things that I can take away from this and go and put on my page and say, Nigerians, let's work for this by 2023.
Come again, Ma. Sorry. Can you come again?
Which one do you want the question?
You were breaking.
Oh, I was breaking. Okay, let me go again. The question is, because of where we are, I want you to give me three things that need to be done. One from the government perspective, one from the individual perspective, and one that we, the NGOs, all the stakeholders, not just NGOs, partners, medics, all the medical doctors like you, what do you want us to do?
Okay, from the government perspective, Mar, I will want the government to invest so much in the National Cancer Control Plan to ensure that cervical cancer or cancer vaccination is part of the NHRA program, so that women or young ladies or even young men and adults can get these vaccines free at the hospital facilities. I also want the government to ensure that they improve more in clinical trials and research, so that Nigeria gains so much, even from international grants. From this research, we need to train more experts because we have limited oncologists in the country. We have limited treatment centers in the country. We need the government to invest so much in this. At least every geopolitical zone should be able to have 1 or 2 cancer centers where people can access treatment. This is a critical barrier in the country. In the aspect of, you made mention of civil societies and NGOs. So NGOs need to also try as much as possible to do same as the government, to complement the effort of the government by involving in researches, supporting local communities, local schools. They could select some selected schoolgirls colleges and see how they can run some pilots, research on them, introduce, because we've done this before in Kebbi State, where we took responsibility of over 200 girls, and we vaccinated them and we followed them through to the end of the vaccination through grants, local grants from us. So NGOs can also, pilot some of these projects and support the government, because the aim of this private engagement is to complement efforts of government also. The third one, Ma?
The people, the public.
Yes, the public should actually believe that vaccine works, vaccine is effective. The issue of vaccine hesitancy should be thrown to the back. People should believe that vaccine works, and we need to, make people more aware. The cultural norm should be a thing of past. People should know that there are vaccine preventable diseases. It has nothing to do with, I don't know, juju, or what do they call it? So people should believe that vaccine works and it's effective. Yes, ma'am.
I want to say very, very big thank you to you. You were awesome. Me and you know what I'm talking about this morning. So I want to say thank you. And from what I've picked up from this, there are plans going on within that government to try to work out how to ensure that we get ourselves in this. This conversation is a national conversation. This month is Cervical Cancer Elimination Month. So let us work hard. Let us see how we can do it. One thing I want to pull out there, and that is very key, and you said it, is research. I am part of the research on cancer treatment, and I would like to encourage all cancer patients, as many of you as possible, if you are interested, try and get yourself in a research, because we need to get the data for us to know what is working and what doesn't work. And I think that's very, very important. So I want to thank you for mentioning research, because that's a big thing for me. Research makes a significant difference. In light of that, I want to thank everyone for joining us. AIT, we really appreciate you. Happy New Year. We're back again, and we're going to be running this with so much more dedication and more interaction. Let's keep it going. For the cancer awareness, we thank our followers for thanking, for sharing this, for getting people aware, because awareness is the key. Once people know what's going on, they know how to address their cancer needs, they know where to find the information. It makes a significant difference. So we want to say thank you. This is 2023. We're going to make a difference as Nigerians. We're going to make a difference in making sure that cancer, together we're going to fight it, together we're going to win it. It's not a one-man business. We thank you all for watching. We thank you all. And we look forward to seeing you in the next 2 weeks, I think. And we have 2 other doctors coming back to come and say. So, Dr. Aminu, I want to say thank you. God bless you. I really appreciate you. Thank you. Awesome. Happy New Year to you and see you soon.
Thank you, man.
Bye.
Yeah, you're back again indeed, Dr. Ejo. Thank you so much. Always a pleasure to listen to you. I hope you had a great celebration and a great holiday.
Well, this is an opportunity to say Happy New Year. The year started, we'll say Happy New Year. But I hear it in your voice. I hear will make a difference. And like we say in this street, more fire, more fire, more fire in this campaign awareness. Dr. James.
Thank you very much. Thank you, and Happy New Year to you guys. And look forward to it. Hopefully, I'll come in and see you guys
as always.
Yeah. I should make an effort.
All right. Don't forget that the Kankaki Cancer Awareness comes up on the 2nd and 4th Wednesdays of the month.